The
content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. Our number is 954-717-7027. We are a Medicare-certified home health care agency located in Palm Beach County, Broward, and Miami-Dade. I am your host, Louise Gomez. Welcome to the show. I am excited to present to you Dr. Justin Dubin. He's actually part of Memorial Healthcare. So as you know, 4 different hospitals with the Memorial Healthcare locations. And he actually has several locations. He can be located at right here in Boca, 900 Glades Road, Suite 500 in Boca Raton, Florida, 33431. The other office is 20801 Biscayne Boulevard, Suite 203 in Aventura, Florida, 33180. Also another location in Pembroke Pines. You can reach out to him. The phone number is actually 305-682-2580. And the website, you're going to want to jot this down, www.mhs.net. Dr. Dubin, welcome to the show. Thanks for coming. We appreciate you taking time out of your busy schedule and coming on. How are you?
I'm doing great. Thank you so much, Louise, for having me on. This is really fun, and I'm glad I get to talk to you and our listeners today.
Absolutely. So, Dr. Dubin, if you can you give us a little bit more of your background? If you could tell our viewers and our listeners a little bit more about your education, your experience, your training, maybe where you did your fellowship. We'd love to learn a little bit more about that.
Of course. So, I grew up in North Jersey, Wayne, New Jersey, to be specific, and I went to Johns Hopkins University for undergraduate school, where I graduated with a biology major. And after college, I knew I wanted to go to med school, but I didn't really want to go right away. I didn't want to go from studying hard to studying even harder. So I wanted to take some time and work. And I ended up applying for several jobs, and I ended up getting 2 job offers actually in urology. And at the time, I had no idea what it was. But I took the job at Weill Cornell in the New York Presbyterian in the Upper East Side of Manhattan as a clinical research coordinator in urology. And I really fell in love with urology then. I ended up, after 2 years working there, going to Rutgers Robert Wood Johnson Medical School in New Brunswick, New Jersey for my medical school training, and I graduated with an MD there. And then I completed my urology residency training at the University of Miami.
Wow.
During that time at University of Miami, I really got interested in male infertility, sexual medicine, and I decided to apply for a fellowship. And a fellowship is like a super subspecialty within, the field of urology. And I ended up going to Northwestern in Chicago, where I focused in male infertility and sexual medicine. The training was 1 year, and I started with Memorial down here in September, and I've been really enjoying my time back in South Florida. And like you said, I have several offices, and I really love the patient population down here. I have family down here. It's been my second home for a really long time, and now it's my first home.
And what I love about your story is that you got really clear on what you wanted to do, right? Because you said you took that time off, you got a job, and then it's like you really got clear. So I venture to say that's something that you're very passionate about, because it's something that you really chose and you decided you wanted. So patients want that. Patients want to know they're dealing with doctors that are really, passionate about what they do. Dr. Dubin, if you could just tell us a little bit more, what is the age range of patients that you treat? Because right away some people might think it's a certain age range, but if you can be a little more specific on that, I would appreciate it.
Of course. So, as a men's health specialist, I actually treat all ages from the age of 18 and older. There is really no one that is too old to see me. And, one thing that I want to highlight about my specialty is that, when I'm talking about the idea of men's health, and maybe this can help, give you an idea of who should see me.
Right.
When we're talking about men's health and male infertility and sexual medicine, that means I focus on things like erectile dysfunction, low testosterone, ejaculation issues, curvature of your penis, as well as, fertility problems. And what I really love about sexual medicine and infertility is that you get to focus on improving people's quality of life. And I feel that most of medicine really revolves around the idea of preventing people from dying or preventing them from getting sick. But what I'm doing with sexual medicine and fertility is we're really focusing on improving that quality of life aspect. And the way I look at it is pretty easy. If someone can make you live for another 20 years, but you can't have, your best quality of life,
Right.
and you can't be your best self, how good are those 20 years really going to be for you? And that's where I come in. And another thing I want to stress here, and it sounds taboo, and especially for men, is that sexual health is health. And, we understand that sexual health may be actually a warning sign or a result of some other health issues, things like diabetes, infection, heart problems, depression, anxiety. These all can impact your sexual health. And I know a lot of guys, really don't want to come in about their other problems, but I'm often the first person that guys may see, and I can point them in the right direction to get their other health problems. And that's one thing I really enjoy, because I can relate your other health issues to your sexual health. And it's just a really fun thing for me to do. And if I can show you that your better sex can come from taking better care of yourself, I can really motivate guys to improve their health and their sex lives along with it. And we're dealing with really two patients. When we're talking about fertility, I'm talking about the man, and I'm talking about the woman to help create a life, right? We're talking about a partnership.
Sure.
So we're really helping two people. And the same thing goes with sex. It takes two to tango. So, that's kind of a nutshell of what I do. And as you can hear from the kind of problems I cover, this can happen to anyone from the ages of 18 or up. And it's never too late. I see 70s, 80s, 90-year-old guys who want to live the best quality of life. And there's no reason to ever think I'm too old, I can't do something. Come see me and we'll have a conversation.
Absolutely. And like you said, it could be a secondary, an issue that's occurring, and then having that ED is just a secondary, result of something that's really wrong. So I think that not only are you fixing whatever that problem is, but I feel like you're helping them in all areas of their health, which is really important, because that's what people want. They want, the whole broad spectrum of health. I did have another question. Can you tell us a little bit more about, because I know prostate health for men is a huge issue, and it's a huge subject, and a lot of people want to know a little bit more. So what could a man do to begin to protect his prostate health? Could you give us some tips on that?
Yeah, so I think, when we're talking about prostate health, I think there's two different categories we really need to break it down into. One, we have, your urinary problems with an enlarged prostate, which is something, that can impact a whole lot of people, a whole lot of men. And, those signs and symptoms of having urinary issues include feeling of incompletely emptying your bladder every time you pee, a weaker stream, harder to pee, to get going, the sense of urgency, waking up multiple times a night. There's a lot of different things with regards to that form of health that can be acknowledged and done. And then you have your other prostate health, which is, of course, prostate cancer, which is the most common cancer in men. And when we're talking about these things, I think in general, when we're talking about cancer, as well as your urinary symptoms, it sounds cliche, but living a healthy lifestyle will always improve both. So believe it or not, for urinary problems, a lot of these things, can potentially be at least not immediately alleviated, but it can be potentially reduced, by consuming less things that are bladder irritants, lots of coffee, soda, juice, all these caffeinated things, drinking fluids before bedtime. I see a lot of patients who say they wake up 4 times a night, but they're drinking, 2 bottles of water within an hour of going to bed. So there's a lot of lifestyle changes that you can do to impact your bladder health and your prostate health in terms of your urinary status. And we also know that things like smoking, eating poorly, not exercising can also increase your risk of prostate cancer. So, these are all lifestyle things that sound very common and, common things and cliche, but they do truly work. And that's why we are here to tell you about it. The other thing I do always recommend for prostate cancer is, understanding your family history. If you know that your father, your brother, your grandfather had prostate cancer, understand what age they had it, what their outcome was, and be thoughtful and make sure to bring that up to your doctor, because that can also help us make a decision on when we're going to start screening you for prostate cancer. So, and I think it's an important note that just because you have urinary symptoms suggestive of prostate problems does not mean that you are at higher risk of prostate cancer. They are not connected in that manner at all.
Good to know.
So if you are having urinary issues, though, or you're concerned about, a risk of prostate cancer, the best thing you can do is see your urologist or a local primary care doctor to get you started.
Good to know. Dr. Dubin, could you shed some light a little bit more on what is andropause? Because some people just never heard of it. They don't know it exists. So if you could share.
So andropause is this idea that as men get older, they have declining testosterone, similar to menopause. Some people call it manopause instead of menopause for them. And we do know that testosterone levels do decline. They decline, I think, after about 41% a year. And we do know that, about 20% of men under the age of 40 have low testosterone. About 20% of men under the age of 60 have low testosterone. That number then jumps up to 30% of men in their 70s. And then about 50% of men in their 80s actually have low testosterone. Now, low testosterone is important to acknowledge. Why? Because having low testosterone, you have signs and symptoms of low energy, depressive mood, low focus, decreased libido. You can have thinning bones. Your bone strength isn't good, and especially if you're an older person, that can be a problem. We also know that men who have lower testosterone are at higher risk for heart attack and stroke. It is so having normal testosterone is theoretically preventative for those things as well. So, if you're having signs and symptoms of these issues, and even if you're younger and struggling with fertility issues, that can also be a sign of having low testosterone, and that's something that I do treat. We also know that people who have, other medical problems are at higher risk of having low testosterone. If you've ever had cancer, if you've been treated for cancer, if you have diabetes, if you're overweight, if you have HIV, AIDS, these are all things that we know you are at a higher risk of having low testosterone, and it's worth discussing with your doctor. I do want to say that it is very, very important that we understand the risks and benefits of testosterone. And we did a recent study where I was a secret shopper for online testosterone replacement clinics. And my testosterone level was normal. I pretended to be a guy who was interested in having a family in the future. I was offered testosterone despite that out of the 6 of the 7 clinics. So I think, and despite that, and I think one of the big things, especially for younger guys or guys who are interested in having children in the future, one of the biggest risk factors of taking testosterone is that it can actually cause infertility. So it's very, very important that if you ever think about taking testosterone, you understand that, and you're having a conversation with a doctor who understands, the risks, the benefits of that medication, and is monitoring you correctly.
Wow. So is the testosterone a bioidentical, or is that a synthetic, or is this, what do they prescribe?
I think it's a synthetic. I think it's so we usually give testosterone cypionate. So there's different ways you can take testosterone. The 3 most common ways are injections, which is probably the most popular. You can inject testosterone cypionate, usually either once a week or once every 2 weeks.
Wow.
The second option is you can use a gel to rub on your muscles daily. Now that one, like, they all have risks and benefits, of course.
Sure.
And then there's another one that's subcutaneous, where you would come in every 3-4 months. I would put small pellets right around your buttocks, and they dissolve on their own. There's also a new oral form that has come out in the last few months, that you would take twice a day, usually with fatty foods. And there's also a nasal spray that has also come out. So there's a lot of different options out there to cater to your goals, to your preferences, and obviously to cost as well.
Absolutely. Since I know you deal with ED, and a lot of people may be wanting to know, are there any new treatments out there or treatments that maybe people don't know about that you can shed some light and share with us? What are some treatments for erectile dysfunction?
Well, I think it's important for guys to understand. I'm going to backtrack a little bit. For guys to understand and our listeners to understand what causes erectile dysfunction. And in order to describe that, and I also want to talk to you about how common erectile dysfunction. Erectile dysfunction is actually the most common sexual health problem that men see. It's seen as high as 30% of men under 40. 40% of men in their 40s, 50% of the men in their 50s, 60% in their 60s, 70% in their 70s. So in order to, so a lot of guys, the chances are going to have this at some point in their life. And so to explain what causes erectile dysfunction, I want to explain the 5 things you need to get a good erection. And if one of these 5 things goes wrong, you can potentially have erectile dysfunction. Now, one is blood flow. You need good blood flow to your penis. Now, and if you think about it, the arteries to your penis are a lot smaller than the ones to your heart. So if you have heart disease, smoking, things that damage the arteries of your body, you're going to have a higher chance of having erectile dysfunction. In fact, erectile dysfunction is a potential early sign for heart disease and heart attack. So it could be the first sign 5 years ahead of the time. So I often ask patients when I see them for a new onset of erectile dysfunction, whether they've seen a cardiologist before in the past. And that's something to think about. So that's one. 2, you need good nerves. Now, your nerves can be compromised by several things, but the 2 most common things is diabetes and surgery. Now, diabetes, people don't really think about. They think about your eyes get damaged. They think about your hands, your toes. But the nerves in your penis are also very small. And often the injury to those nerves can compromise your erections. And then when we're talking about surgery, we're talking about things like pelvic surgery, prostatectomies for prostate cancer. That can very much compromise your erections. Doesn't happen to everyone, but it does happen to patients who get that treatment. Radiation as well. 3, you need good hormone levels. And by hormone levels, we're alluding back to what we were talking about before, good testosterone levels. So I always get on my patients with erectile dysfunction a testosterone level to make sure everything's okay. Now, the 4th and the 5th ones are more interesting and I think more esoteric. 4, you have to be aroused. And I think that sounds funny and it's like a no-duh kind of moment.
Right.
But, people have relationship issues,
Sure.
right? There's issues within relationships. People fall, their relationships can be compromised. And you can feel a certain way one day versus another day. And I see guys all the time and partners going through this all the time. And this is something that you can talk about. I refer people to sex therapists or just therapists in general to discuss these relationship issues. So that's the 4th one. And then the 5th one is you need to be in a good state of mind. If you are anxious, you have depression, you are, these are things that are going to compromise your ability to have an erection. To quote the late, great Robin Williams, he said, God gave man a brain and a penis and only enough blood to control one at a time. And
oh my God, I like that.
absolutely correct.
I like that.
So he is absolutely correct, so it's something to consider. And also, unfortunately, treating those things like antidepressants can also cause decreased libido, erectile dysfunction as well. So it sounds simple, but there are so many things to cover when we're talking about the things that can cause erectile dysfunction, which leads us to how do you treat it? So in general, the most common thing is something like a Viagra or Cialis. These are medications that are relatively safe. There's very few contraindications. Some people who are on specific medications for their hearts may not be able to take them. But in general, I think the most important thing you need to know about these medications is how to properly take them. I see a lot of guys come into my office. They say, Doc, Cialis, Viagra doesn't work for me. And I ask them, how are you taking it? And they are not taking it correctly. These medications do not take 5 minutes to work. They take about 15, 20 minutes. You need at least 2 hours. I tell my patients 2 hours on both of them. Viagra, 2 hours on an empty stomach. Cialis, 2 hours with or without food. So that's the most common one. Then you have things like injections. You have penile injections, believe it or not. You can inject a medication directly into your penis. The difference here is that, when you're talking about medications like Viagra or Cialis, you have to get aroused. It's just a medication you take, you have to get aroused. You are literally bypassing your brain when you're injecting into that area. So you will get an erection. Now
We're gonna wrap this up real quick. We're gonna take a quick break and we'll be back. Oh, so we'll be we're gonna have you back because there's a lot more questions we want to have. So we'll definitely have you back. But I wanted to just reiterate where you're at. You can find Dr. Dubin. He's affiliated with Memorial Hospital in Miramar, Pembroke Pines, in Memorial Regional West as well. And he can be found at www.mhs.net. That's Dr. Justin Dubin, located also in Boca Raton, Florida, 900 Glades Road, Suite 500, and that's Boca Raton 33431, also in Pembroke Pines, as well as in Aventura, 20801 Biscayne Boulevard, Suite 203, Aventura, Florida, 33180. His phone number is 305-682-2580. We're going to have you back because there's so many more questions I have for you, Dr. Dubin.
I can go on forever, obviously. I'm so sorry about
No, not at all. No, not at all. We're so happy to have you, and we're definitely going to have you back. So thank you so much for sharing all your knowledge and experience with everyone. We really do appreciate that. Thank you so much, and we'll see you soon.
Thank you for having me.
Absolutely. Take care.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthy